Welcome to the next episode in the Iron Deficiency YouTube series, Iron Deficiency Lab Work. While the list presented here is not all-inclusive, they do provide a bare minimum of properly diagnosing low ferritin. I will also discuss additional lab tests that I get done periodically for other vitamins and minerals that can possibly interfere with proper absorption and uptake. But these are generally not required unless you suspect you have a problem or know you already have a problem and are monitoring your progress. Medical disclaimer. I am not a medical doctor, nor do I have any formal medical training. All content found in this video, text, images, audio, figures, etc., is for informational purposes only. The information presented is from my own research and my interpretation of that research. This video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or read about in this video. You should never supplement iron without physician oversight. Too much iron is dangerous and possibly fatal. First up are iron-specific labs. The first is serum iron. This is simply the amount of iron that is in the liquid portion of the bloodstream. Serum iron is mostly bound to transferrin. This test is pretty standard. A complete blood count, or CBC for short, is also common practice when assessing for iron deficiency. To the trained eye, I think it can be helpful for assessing someone for low ferritin, but it seems like it is used more for assessing for iron deficiency with anemia. For me personally, as my ferritin drops and goes below 30, my platelets begin to increase. A medical doctor on Twitter kindly explained to me that platelets go up because red blood cells and platelets have a common precursor. And if there's no iron to make red blood cells, then that means more red blood cells turn into platelets. So while a CBC does hold some clues for me, I am not sure if that is universally true for everyone. Another common test that's ordered is the total iron binding capacity, or TIBC for short. TIBC is the sum of serum iron plus unbound iron. In other words, TIBC measures the total amount of iron that can be bound by proteins in the blood. TIBC is basically an indirect measurement of transferrin availability, but it isn't synonymous with measuring transferrin directly. The most important test on this page, in my opinion, is ferritin. This test is almost never ordered when assessing someone for an iron deficiency unless you explicitly ask for it. Ferritin is a protein that stores excess iron. Think of it as a bank for iron. While it is only low in cases of iron deficiency with or without anemia, it can be elevated in cases of inflammation. This can be differentiated with an STFR test, which isn't affected by inflammation, or a C-reactive protein test. Transferrin is a protein that binds to and carries iron through the blood to all tissues, vital organs, and bone marrow. Transferrin might be decreased in people with inflammatory processes occurring. This isn't routinely ordered, but might be helpful. The last test, which can also be very helpful and some doctors like to use, is STFR, which is short for soluble transferrin receptor. In cases of functional iron deficiency, it will be elevated. This is not something that is commonly ordered, but you can certainly ask for it. When you get these labs done and look at your report, you will also notice additional numbers and terms, and these are calculated from the directly measured values that we just discussed. One common calculated value is the transferrin percent saturation. On the lab report, this is generally referred to as percent saturation. This is calculated by dividing the serum iron by the TIBC and multiplying by 100. This value tells you how saturated transferrin is. Remember though, that because TIBC is an indirect measurement of transferrin, that the percent saturation is also an indirect calculation. There is a range that it should be in. For iron deficiency, it will either be normal or too low, depending on how iron deficient you are. It is worth noting too that when I first started treatment with oral iron, my percent saturation went up really high before settling back down into the range. To close up this portion, don't just assume that your doctor will order the right tests. Ask what they are ordering and make sure you understand what they are ordering and what information can be gleaned from those tests. Never be afraid to ask questions if you are unsure of something. Next, I'd like to talk about additional labs that might be helpful. The first set of tests are related to copper. The two I get done are ceruloplasmin and total serum copper. There is also a 24-hour urine-free copper test that could be helpful to some people. Ceruloplasmin, a protein that binds to copper, is involved in iron transport. Iron needs adequate amounts of copper to reach some parts of the body, like the brain. The total serum copper is important because it can alert you to a copper toxic state, which almost always involves a decreased zinc level. Copper, while necessary for proper functioning, is very destructive at high levels. And it's not the bound copper that is destructive, it's the unbound copper. Hence, the possible importance of a 24-hour urine-free copper test. If at high enough levels, it can cause severe mental health issues such as bipolar disorder, paranoia, psychosis, and schizophrenia. The second test is serum zinc. There is a zinc RBC test available that is said to be preferred, but I'm not sure where it is available. I know it is not available in New York State at this time. Zinc is important because it is one of the precursors in the production of stomach acid. If zinc levels are low, you might not have adequate stomach acid. And without getting into the details of iron absorption, an acidic environment is important. Another set of tests that are important are those that evaluate your vitamin B12 status. The set of tests I got done for this are serum B12 and methylmalonic acid, often abbreviated as MMA. B12 is a cofactor in red blood cell production, so you want to make sure you have enough. I have been told that a good target is 700 to 800 picograms per milliliter. Like anything, this is person dependent. Some people need much higher levels to be symptom-free. The purpose of the MMA test is to make sure that your body is utilizing the B12. MMA is a functional biomarker for B12 status. MMA is converted to succinyl-CoA using vitamin B12 as a cofactor. As you might guess, if you are B12 deficient, you will get a buildup of MMA in the body which can be directly measured. The last test that I like to get from time to time is serum folate, also known as vitamin B9. Adequate levels of B9 are important for proper B12 utilization. Another issue that comes into play here are the roles of the MTHFR gene, but I am not well versed on that subject and encourage you to research that on your own and consult your treating physician. Just like there are a few different forms of B12 that can be taken, the same is true for B9. Last, I will talk about how to get labs done. The preferred method is to get a lab requisition from your provider. It's important to have labs interpreted by a physician and to have them oversee your supplementation regimen. As time goes on, though, you might find that you are able to interpret your labs as well. Although this is the preferred method, there are unfortunately circumstances where your doctor is unwilling to take your concerns seriously, and sometimes you have to do what's best for you. In the US, there are other places where you can order your labs yourself. The two that I know of that are through reputable laboratories are Quest Direct and LabCorp Pixel. Please be aware that at the time of this video, you have to pay out of pocket for these tests, and you cannot use your medical insurance. Once you receive the results, it is important that you share them with your doctor. Again, while this isn't the preferred way of doing things, sometimes you have to do your own testing. Thank you for watching this episode, and I hope you better understand what tests are important in testing for iron deficiency with and without anemia. As always, any medical questions should be directed towards your treating physician. Stay tuned for the next episode where I will talk about how to understand your labs. The next episode will not be in depth, but will just teach you the basics. An in-depth analysis of your labs should only be completed by a trained medical professional.